name is Rashida Ferrand. I am a professor at the London School of Hygiene and Tropical Medicine, but I've been based at the Biomedical Research and Training Institute in Zimbabwe for about 15 years. What our research focus has been over the last 10 years is identifying whether large numbers of, identifying how long children survive and what services are available to them. In the first 5 years of my work here, we demonstrated that there were many children who had been infected through mother-to-child transmission, who were then making it to adolescence without having been diagnosed. Prior to this, the assumption had been that children died in infancy if they were not treated. And we and others have also shown that children do particularly badly in terms of remaining on treatment, and as a result the control of the virus in their bodies is much poorer, because you require, one should be taking treatment consistently to ensure that the viral levels are controlled. So this was the background to the work that we started about 5 years ago, funded by the Wellcome Trust. We initially looked at how we could improve testing services and how we could make testing more accessible to children. And so the first starting point was to see how well whatever was actually going on in clinics did. And nearly half of the children did not end up getting tested. There are lots of structural issues such as lack of kits, lack of testing, of staff, and the fact that children are a low priority for testing. So this led us to look at other testing strategies in the community. We've looked at whether providing incentives works, and we've shown that that increases testing. We also used a tool to screen for those that might have been higher risk, so that those who are screened positive are then offered testing, and this reduces the number of children that we need to test. And this is a particular strategy that could be used in settings where there are resource constraints. The main focus of our work with Zenth has been to run a randomized controlled trial to see if support offered by community workers improves retention in care and improves viral suppression, i.e. the control of virus. And what our findings have shown is that the community workers offering support to caregivers and children substantially increased viral suppression rates, i.e. virological virus control in children in our study. So there was 33% improvement in viral suppression rates, and we hope that these findings can be taken up for further scale up and implementation more broadly. Thank you.
So it's really to highlight the importance of research as a tool for decision making, as well as to highlight the importance of having such meetings so that you can disseminate and let people know what has happened and how that information can then be used. We are happy that Dr. Ndebele is here representing, he's the Director of Medical Research Council of Zimbabwe, and I'm sure all of us, as we know, when we do our applications, there is that aspect of, one of the requirements is that at least at the end of your project you should disseminate what you've been doing to the community themselves that are affected and also to the various stakeholders. So we are very happy that Professor Rashida Farrand has been able to organize this meeting so that we can be able to share the information that we have been gathering for the past, I don't know, it's a long time, 4 years, for the past 4 years. So just to let you know that the Biomedical Research and Training Institute basically is there to support researchers, whether locally, internationally, and regionally, who would like to conduct research in Zimbabwe but would like to have an affiliation, an institute of affiliation. We are basically run like a research support center to provide infrastructure, infrastructural support, as well as administration, financial management, grant management support.
Done by BRTI in bringing us to this moment. I know it has taken some years to do some of the studies that are going to be presented today, and it is truly encouraging that we have science to guide some of the work that we do within the Ministry of Health and Child Care. From the introductions, I could gather that, you know, we do have people who are based here in Harare. We have the team from BRTI and the Zenth team that are here present. There is a lot of hope. We know that with treatment, we can keep these children alive. With treatment, our children do not have to have stunted growth. They don't need to be sick with repeated inpatient admissions. We can keep them HIV free. And so when you look at that framework, it's really talking to prevention, it's talking to keeping our children negative, and where somewhere along the line we haven't quite made it and we've got infections that have happened in our children and adolescents, we can keep them AIDS-free by making sure that we treat them early. And so it's very encouraging, I think, for me, when we have the science and the scientists in the room that have done this research, to see, first and foremost, I also notice on the program, we are talking to finding children. Now, when you are talking of children, you are not talking of one homogeneous group. I think it's so clear that children cannot just be reduced to little adults, full stop. You have to look at the life cycle approach. Maybe talk about the first decade, the first 10 years of life, the second decade, the next 10 years of life. You can even break it down to the first 5 years of life, the next 5 years of life, etc., etc. And I think our key population of interest would of course be the adolescents 10 to 19 years. Very important, I think. And so I'm quite excited to be here to listen to the findings that have been done in trying to find these children. And when we find the children, in putting them on treatment, and when we put them on treatment, in supporting them through the very difficult challenges of adherence to treatment. So I'm very passionate. I could go on and on talking about the issues of children, but I want us all to go with the thinking that, you know, children do have rights. I don't think we pay particular attention to the rights of children. And I'm so pleased that this meeting is putting children at the center. You are talking about children. They need a voice to articulate their wishes, and we need to listen to the children that we are also passionate about.
I am Nevadodo. I was working in Kwazana community. I was working in Sister Joy at Kwazana Polyclinic. Yes, while we were there, we started our research. At first, things were not okay, but as we move on, things started to go very much well, which we actually have so many successes. At first, people, like actual caregivers, were not willing to talk actually about their children's status at their homes. So we met the caregivers and the parents in parks, as what Jackie has been saying. Then, just after a little bit, we talked to them, counseled them. After talking to them, they now agreed. Now we achieved so much. We started to have conservation at their homes. That also made us comfortable because we were fearing for all of the confidentiality, since that was our minimum, so that we want to protect the child. So after a while, that's when we started to talk to them. After we actually talked to them, we started to talk to them at their homes. So I think that was a very, very, very positive thing which we did. Again, we were actually now a family between we VLWs and their families. We were when I didn't visit them for a week or two, they actually phoned me, "Where are you?" That showed that we have good rapport between us and the family. So I think that was again positive. Up to now, some are still phoning us and asking, "Where are you? Can you just come and see us?" Not even because of what we were doing, but just because just to go and talk to them about our social life. That's some of the positives we have. Also, the stakeholders, actually from the City Council, the Ministry of Education, the Ministry of Women's Affairs, etc. We actually have a good rapport with them because they know our work and they appreciated it. So we are now working very well with all other stakeholders in the community. That's making our job easier. Up to now, even I go to the clinic, people might think that I'm working at the clinic. Why? Because of the rapport which I created during the course of our research in the PRTI. So I think that's where the main positive things which you gain during the research.
Hi, I'm Jackie. I'm one of the VLWs. We faced challenges as VLWs, and the most common challenge we faced was disclosure. Parents, caregivers would not want to disclose children's status to them, fearing like people talking, or it was the issue of confidentiality. They didn't even they wanted to protect themselves even as well, because they would know once they disclose the status of the child, obviously the community would know that they are as well positive, and that would affect them. And because of this HIV and AIDS pandemic, they would fear the issue of being promiscuous or something, so they would fear to disclose to the children. But that was a barrier, because we could not refer the children to the support groups where they could get more help, where they could see other children of their age that they're living positively as well, and they can move on, they can do something, they can achieve their dreams despite that they're HIV positive. They can also achieve their dreams, they can marry, they can have kids at the end of the after achieving their goals. And also the issue of confidentiality, we noticed that because of this HIV and AIDS, with community, and mostly since I stay in the community, they would fear that maybe I would move around and spread the issue that they're living positively. But that was the main thing we were taught when we did our trainings with foreigners, that we should be confidential, and we were also taught to draw ourselves when we get in the communities. Like for example, when I go to a home, when I visit and I find them sitting on the floor or sitting on the mat, I would just sit, I would draw myself to that level, not asking for a chair, so that I don't look superior to them, but I want to be on the same level with them so that they will accept me more. Now we've created a very good rapport and a relationship, and a very big bond. They actually phone and they actually call me aunts. Not Jack, they actually call me aunts, and most of the kids, they really love me. And I'm also engaged in the girls program dealing with children with HIV and AIDS. So they really disclose, and they're so free to speak up or to open up with the issues like dating, adolescents, on issues of dating despite their status. So, and I even empower them, I even educate them on when to date, what's the right time to date, and with your status, what do you do, how do you go about it, on issues of disclosure to your partner or to one success story of a girl. I won't mention the name for confidentiality purposes. This girl, when I first met her, the CD4 count was on 8 cells. And that she was very sick, very sick, and the parents were so worried because they feared maybe the child could die or something. But then when I counseled them, and I even helped them, and I even educated them on the importance of disclosure, on the importance of adherence, they really adhered to their medication and everything, and the child is now well, very fit, and she's actually joined the support group, and I've also referred them to other stakeholders because they're having problems with challenges on fees and challenges on food, and the parents did not have anything to do, like a source of income to help in the house. So I referred them to an organization. I won't mention the organization as well. I mentioned them to a stakeholder, and they were assisted with fees, with food, and with the IGAs to start with. And this family is very happy, and they're very appreciative, and we're in good relations. I'm like a close relative to them.
For these and other stories, visit our website www.263chat.com. Follow us on Twitter @263chat and like our Facebook page 263chat.